Hello, I'm Sienna Bowes. Welcome to my channel, Learning Builds Life. Today we are going to talk about clinical anatomy. So let's begin. Now all of you must have heard of the suffix itis. Itis. The suffix itis indicates an inflammation or swelling. Inflammation or swelling. Some examples are dermatitis, a classic disease which happens in most people, inflammation of the skin. This is for skin. Then comes tonsillitis. Inflammation of tonsils. Arthritis. Inflammation of the joints. Neuritis. For the nerves and neurons. And lastly, appendicitis, another classic disease. This is common in most children. It is an appendix inflammation. The appendix is a small organ located just at the side of the colon, which is the large intestine, but not really an organ of importance. But if there is inflammation of appendix, it must be taken into immediate medical care, because when it bursts, it may lead out all of that pus or whatever was inside that inflamed appendix to go all and spill out in the body, leading to complications. That was all about the suffix itis, that means inflammation or swelling. So now you may take a look at the board. Moving on to ectomy. The suffix ectomy. This means removal from the body. Removal from the body. Some examples are appendectomy. This is a surgical method to remove the appendix, and that is done when a person suffers from appendicitis, which we discussed previously. Removal of appendix. Next comes tonsillectomy. Tonsillectomy obviously means removal of the tonsils. Gastrectomy. Removal of the whole or parts of the stomach. That means we can either remove the whole stomach or some parts of the stomach. That is gastrectomy. And lastly, we have nephrectomy. That That is removal of a part or the whole kidney. That means we can either remove the whole kidney or some parts of the kidney. That was about the ectomies. Now you may take a look at the board. Now we will talk about otomy. Number 3, the suffix otomy. Otomy means the opening and then again closing, opening and closing of a hollow organ. Some examples are Laparotomy. This is a surgical procedure in which we make an incision in the abdomen. Incision in the abdomen. Then comes hysterotomy. Hysterotomy. This is basically removal of uterine contents. Of uterine contents. That means the contents of the uterus. That is hysterotomy. Next comes cystotomy. Which is a surgical procedure to make an incision in the urinary bladder. Incision in the urinary bladder. Lastly, we have Cystolithotomy. Cystolithotomy. And this is removal of bladder stones. Of bladder stones. That was all about the otomies. Now you may take a look at the board. Moving on to ostomy. The suffix ostomy. This means the opening of a hollow organ. But then we just leave it open. We don't again close it like we discussed in otomy. Opening of a hollow organ and leaving it open. Some examples are cystostomy, which is an opening of the bladder, the urinary bladder. After cystostomy comes tracheostomy, which is an opening of the trachea, or in common terms, the windpipe. windpipe. But don't worry, you must be thinking like, oh, then how will the person breathe? In this surgical procedure, we keep the windpipe open, but we insert a tube to help us to breathe. That is tracheostomy. Lastly, we have colostomy. And the name suggests for the colon, ostomy of the colon. The colon or the large intestine. So that was all about our ostomies. Now you may take a look at the board. We will discuss the rest of our clinical anatomy in our upcoming episodes. Till then, stay tuned and please share, subscribe my channel, and stay tuned for more videos. Thank you.